Namaskar, I am Dr KK Aggarwal, Group Editor-in-Chief, IGCP Group, and I have with me Dr Neena Malhotra. She is an Obstetrician and Gynaecologist and Professor at All India Institute of Medical Sciences. I am talking her three views on a subject: what she has to say as Neena Malhotra, what she has to say as a Professor of All India Institute of Medical Sciences, and what she has to say as a FOXY member. And my question is the question of medical abortions. And now, see, in HIV, we are having direct to consumer testing. In pregnancy, there is a direct to consumer testing. Emergency contraception has gone to direct to consumers. Should medical abortion go direct to consumer? That means anybody, whether homeopath, Ayurved, naturopath, yoga experts, even healthcare workers, should they indulge, even ASHA workers, should they indulge into the concept of medical abortion, which is up to 8 weeks?
Yeah. Okay, so I think there are two aspects. We're talking of surgical abortions and medical abortions. That means we already have an access to over-the-counter medical abortion, which is mifepristone and misoprostol, which came and was passed by the ministry way back in 2008 or 9, if I can recall. Now, having trained in UK and have worked there for long, and of course I've had the exposure to work, do a fellowship in US. If I look at those societies where there is a midwifery-driven units, where women till date would prefer to have their baby delivered, I'm not talking of abortions, have a baby delivered in a midwife's unit. And in a society like ours, where we are liberal about miscarriages of abortions, access to medical abortions, and I'm talking this as maybe a combination of a doctor and Neena Malhotra, I think it may sound reasonable. Why not have it when a district health nurse or a midwife can do things? Why will our people be sort of refused? After all, at the end of the day, they have gone through a training. But it's very important to understand that what is the level of training. We're talking at one end of a homeopath, and the other end we're trying to say, yes, is he or she has the license to do that. I think it's not important to get demarcations or stratifications in terms of Ayurveda, yoga or XYZ. It's important, has he or she got the accreditation and the fair knowledge of giving it, i.e. not in terms of giving, of understanding what are the problems. See, the hue and cry always comes when there is a complication. And that's what puts us into in the ambit of medical legal problems. So I think for us it's very important to understand that if we are giving the right for any of these other Ayush related health care providers, it's very important for us to understand, do they understand the importance of recognizing the I would say adverse events that happen. So that is one thing. But being a FOXY member, I think it's very important when a lot of us get complicated cases. I think the numbers are dwindling, but I could recall, say, 5-7 years back, where once in a month we would get a septic abortion. Now, who did it? So that's the thing. I wouldn't say yes, it was a person who was a homeopath or it was an Ayurveda. It was definitely coming from an untrained person. And that's the message, because when you have a mortality and more so a morbidity coming from a septic abortion, it's very difficult, not just salvaging the life of that woman, but then the long-term morbidity that a woman suffers. So I think that's very important for us to understand.
If 100 women are given medical abortions, how many of them will have complications?
Well, if 100 women are given medical abortions, which we mean oral and vaginal or whatever route we give, and it is done rightly with the right decision, then I think 2 to 3% should land a problem.
And then the problems are?
Well, the problem could be that there is a failure to have the abortion, or if there is, I would say, again, a judgmental error or an error of judgment. That means the diagnosis was not a pregnancy in the uterus, was perhaps a pregnancy in the tube, an ectopic pregnancy. So that kind of a situation, I would just say put to 2 to 3%. The other side is when there is a failure of abortion to happen. That means we know that a medical abortion given rightfully but before 9 weeks should result in a success close to 85 to 92%. So we know that the 10 to 8% or the 10 to 9%, whatever we can say, would fail to have an abortion. In that case, I think that number needs to be seen by a specialist, rather than again be managed by somebody who is not very well versed with it.
So that's an important subject, and that is medical abortions. The government is trying to amend the MTP Act, and they are trying to, the Indian Medical Association has been opposing that. and the amendment is still not come in the parliament. Let's see what the government does.